There's a website called Everytown for Gun Safety that monitors school shootings in America. They report that because of the increase in school shootings, we should have greater gun control in the United States. They go on to report that in the 2 years following the Sandy Hook shooting, there was roughly 142 school shootings. That averages out to about one school shooting every week. Wow, that's a lot of school shootings. However, I'm here to tell you that guns are not the real problem. The lack of mental health services in the United States is something we should be looking at as the real problem. I'm a mental health nurse and have been for the last 26 years. I'm also a psychiatric nurse practitioner student, and I have a sincere interest in the lack of mental health services in America. Mental health issues are something that affect all families, so it's something we all need to be aware of. We're currently in a mental health crisis. There are 4 barriers that have been identified that impair access to mental health care. And more funding is needed to address some of those barriers to make mental health access more available to the general population. According to the 2015 National Survey of Drug Use and Health, 18% of the population in 2015 had a mental illness. This means that in 2015, roughly 1 in every 5 people had a mental illness. According to the National Council for Behavioral Health, the United States is in a mental health crisis, with 56% of Americans seeking psychiatric services. That's over half of Americans. The National Council reports that there are 4 barriers that primarily impact Americans seeking psychiatric health services. The first barrier is the high cost and poor coverage on insurance for mental health treatment. 42% of Americans identified the high cost and poor insurance as the main barrier keeping them from seeking psychiatric services. 25% said that they had to make a choice between mental health services, which includes medications that are needed, or the basic daily needs such as groceries. In America, people shouldn't have to be making those kind of choices. The second barrier is the limited options and long wait times for seeking psychiatric mental health services. 38% of people in the study reported that they had to wait greater than 1 week before they were able to get any face-to-face psychiatric treatment time with someone. And more than half reported that they either knew somebody or they themselves had to drive more than an hour round trip to get psychiatric mental health services. Again, this shouldn't be happening in America. The third barrier is the lack of awareness of mental health services. 29% of the population reported that when seeking services for themselves or somebody else, they didn't know where to go to get those services. There's not enough education in America right now telling people where to get these services. And that's just really sad. The fourth and final barrier is social stigma for mental health. 31% reported that they felt like they were being judged for getting mental health services, while 21% actually lied to somebody about getting mental health services so they wouldn't know about it. How is it that we live in America one of the strongest, most powerful, and modern countries, and yet there's still a stigma on mental health services. People are afraid to get help because they're afraid for someone to know that they have a mental illness. That just doesn't make any sense. So that's the problem. But what can we do about it? According to the president and CEO of the National Council for Behavioral Health, additional funding is needed for providers to meet 3 goals. The first is to provide more staff and providers that would allow us to provide more services to the United States in general. The second goal is to utilize new technologies such as telehealth to be able to reach out further out of the main communities into the rural communities, providing more psychiatric services and with a much shorter drive time to re-access those services. And the third goal is we need more research into psychiatric illness and options that we have for treatments so that we as providers can give the best possible services to our clients on a daily basis. None of that is too little to do in America. In conclusion, there's a lack of access to mental health services in the United States, and 4 barriers are primarily to blame. The cost and poor insurance, the limited options and long wait times, the lack of awareness of mental health services in America, and the social stigma associated with mental illness. In 2015, 1 in 5 people had a mental illness and were seeking services. Now, today, roughly 3 in 5 people are seeking services for mental health care. How many people are in your family? The next time you hear someone talking about gun control and the need for gun control, I want you to think about the fact that we don't have enough mental health services, and that is the real problem that we should be focused on in America. The reason for this is guns don't kill people. People kill people. Thank you.